Hi, everybody, and welcome to our webinar. Couple things before we get started. Today, you will receive a recording of the webinar as well as a copy of the slides to share with whoever you would like. This webinar is good for CEUs. We are waiting on that certificate from the Compliance Certification Board, but we look forward to sharing that with you as soon as we get it. So we are Provider Trust, and we believe that a smarter healthcare makes a safer healthcare. And we live this out by monitoring healthcare populations to identify compliance and credential issues before they impact patients. Today, we're going to be talking about a requested topic here, responding to workforce reduction and how to do more with less. We all have less resources, less folks, and so we've got some great highlights today, some great information to share with you. Today, our presenters are Tim Ridgway. He is our provider segment leader. He works with healthcare organizations across the nation to help them improve their efficiencies with our automated processes. And this is Donna Thiel. You may recognize from past webinars. She is our Chief Compliance Officer. Donna has years experience as a compliance officer and just brings a great insight to PT. And we're happy that they're both here today. So you've got some great presenters for today's topic. A little bit about our agenda. We will start off just covering workforce reduction, what that looks like today. Then we'll move into operations and constraints, then into learning and retraining, and then we will finish up the presentation covering the process control and risk management. So with that, we do have a few polls today, so please please tune into those. We love that feedback, and also we have a survey after the webinar today that we would love for you to fill in. We want to make sure that we continue to bring value, continue to bring you guys these webinars for CEUs, as a lot of your CEU opportunities have dwindled recently. So we're happy to do that. Just please fill out that survey, and we will continue to make these better for you guys. So with that, I will hand it over to Tim to talk about workforce reduction.
Thanks, Matt, and good morning or afternoon to everyone that's joining. We certainly appreciate you carving some time out today to be with us for the next 28 minutes or so. I suspect that we're probably kind of tired of talking about COVID-19, but as we're out there talking to the market and sharing experiences, we recognize, much like you all, that there's so many symptoms that we are experiencing as we navigate, the wake of COVID, and how that wake keeps coming in different waves and in different phases. And so we wanted to start the conversation today with a very relevant symptom that is also pretty sensitive, right? Which is the workforce reduction that we're starting to see in the market, and how we can help support that conversation, provide some best practices, and talk through how to create some efficiencies in this environment of having to do more with less. And we're all unpacking the impacts of the pandemic right now as we're facing the confluence of reduced patient volumes and lost revenue, and coupling that with high human capital costs, that unfortunately leads itself into some level of workforce reduction efforts. And we're hoping, obviously, that these are short-term, but these may extend into more long-term strategies that require some significant consideration for those that are affected. So there's a trail of potential risk, and just a pain from an administrative point of view that we'll want to talk to today to help prepare for the various scenarios and situations that we will likely experience in the coming months. So if you're anything like me, there's been a lot of emotions lately. I've got 3 young children at home. We naturally felt a little fear when this all started to happen. And that kind of moved into uncertainty and quite a bit of anxiety. That then also manifested a bit of boredom during the quarantine. But now we found ourselves kind of back in fear mode, and frankly are exhausted. And just when we think it's time to take a breather, we're reminded that, gosh, there's just so much to catch up from the last few months. We in our house try to anchor to a lot of the positive experiences, in both personally and professionally, right? I've been involved in many experiences, and I've heard many stories about the healthcare community and how we've pulled together in response to COVID. But today we wanted to talk about, frankly, a few of the challenges as we as a healthcare community are going to have to face. And so here are just a few that are really stemming from the financial challenges that we're experiencing due to the pandemic. Items that affect and impact our staffing, including the loss of revenue and the increased administrative costs to support either the surge of patients that are coming into the facilities or the preparation for a surge of patients that may come at some future point in time. The benefit program adjustments, which is essentially tying directly back to workforce reduction and evaluating our benefit programs to support those that may be laid off or furloughed, and how we can help support and provide the benefits that they've come to rely on to help support their families. We hear and recognize that there are a lot of contract negotiations occurring today around reducing costs, acquiring different vendors to create some efficiencies, and having to do that while facing budget cuts. Either that is a cut to the budget or the complete elimination of the budget in a functional area makes designing those processes very difficult. And when you couple those things with, well, now I have a much smaller team potentially that is there to support the administration and the operations of our facilities and of our system. It gets very difficult to navigate that. So luckily and happily that the government and Congress stepped in and have provided some funding that was very much needed. But that funding had created a bit of frustration initially on how the funds were appropriated. Essentially what we've seen so far is that there's just a wide variance of available cash on hand, right? So for some of these systems that have that are much more financially healthy and stable, they may have years of operational emergency funds that can support operations during a situation or a scenario in which we find ourselves in today. But there are a lot of hospitals that maybe only have a month or less of cash on hand and may only survive through acquisition. So there's a number of things that we want to share with you around tracking and some of the reports and the resources that are available. Matt, if you want to change the slide. The reality is that this just might be the beginning. A lot of the systems, the hospitals that we talk to and that are reported on, the volume and the revenue impacts primarily hit the last 2 weeks of March. And that just goes to show how quickly the pandemic had upended this industry. And the results, unfortunately, might be even more dramatic in the coming months as hospitals experience kind of the prolonged effects of the pandemic and COVID-19. Just today, I read an article that 26 states are experiencing continued surges in patients in some areas that were previously unaffected by the pandemic in a surging of patients are taking measures that they just didn't have to before. These are places in rural America that are creating field hospitals and children's hospitals that are admitting adults and many other processes to support their community. So the two resources that I think are helpful are the Healthcare Dive and their hospital workforce tracker. It's a good resource if you want to evaluate the pandemic response from the health systems that Healthcare Dive had surveyed, which essentially is describing how they're managing workforce reduction. And there's very positive stories inside of this about health systems that are not anticipating any furloughing or any layoffs, to systems that are closing entire clinics, and some very large systems that are estimating about a third of their total workforce may be at risk of layoff, in which designing these benefit and altering the benefit programs are going to become very top of mind for them to support their pay base. If data is your thing, the the Kaufman Hall report provides a pretty detailed viewpoint of the financial impact of the pandemic. They looked at about 800 US based hospitals. And there's a lot of detail inside of this report. It is a great resource. I can boil it down very quickly to volumes, patient volumes and revenue are down significantly, while expenses continue to rise to support the pandemic and the response to the pandemic. Matt, I think you've got a polling question here.
Yes, we have 3 polls today, and this is the first one. So I'll go ahead and launch this. And yeah, we're interested in what represents the biggest challenge for you guys on the call today in your workforce since March. So is that staff layoffs? Is that furloughed employees, reduced schedule? Is it wage related, or is it other? And if you do choose other, we're interested in what that might be. So just chime in if you feel inclined. Please chime in there and just let us know what that other might be. We'll leave this open for just a few more seconds. Give everybody a chance to vote. And we'll go ahead and end that and show the results. So yeah, the majority is other. We're very interested in what that could be. Yeah, thanks everybody for chiming in on our first poll here. We've got a couple more, and just appreciate your input.
Thanks, Matt, and I certainly love to see the results of that. And frankly, it sounds like, or it looks like the audience is really trying to mitigate as much of the workforce reduction as possible. So obviously we know that that isn't always a possibility. And so Matt, if you want to move to the next slide, we can start pivoting the conversation to how we can control our response to the pandemic. And frankly, that involves identifying some workforce goals that'll be critical to establishing a sound plan that will help navigate, the kind of the unknown road ahead. We really bucketed the workforce goals into 3 buckets of, yesterday, which is essentially, the beginning of the pandemic and our response, what we're dealing with today, and what we can anticipate to come tomorrow. And so as we go through this presentation, we'll dive a bit deeper into each of these. So starting with evaluating our initial reactions, right, when the pandemic had hit, you likely identified a few non-negotiables and a few emergency protocols. An example of that might be for facilities that were just managing a surge of patients. The onboarding process might have looked quite a bit differently during that time than it had the weeks or the months or the years prior. Maybe a quick background check, a very brief quick license verification to ensure that these people have a license that's in good standing and they are not a bad actor, and putting them on the floor to provide care to patients may have been the extent of the onboarding process, or some variation or version of that. Likely, though, that process had differed from what it looked like a couple of weeks or months before. So once these emergency protocols are being implemented, right, there's probably a great deal of time that you'll spend kind of unwinding some of the past behaviors that you had influenced and policies that you've created to match this new normal. And so a really big question inside of that is, well, which of these processes will need to last, right? And hopefully we would love to be a thought partner as we continue to have these webinars and learn more about the pandemic and the response, and we can continue to share what those may be. So when we think about today, we're often finding ourselves just trying to weather the storm, right? That is things like controlling our expenses, supporting and protecting our workforce, placing emphasis on new and unique technologies like telehealth, maybe technologies around patient safety, and hopefully reopening the doors to many of the elective and non-essential medicine that is driving a lot of our revenue and offsetting a lot of the costs to support our operations. Again, there are some good stories inside of what we're reading and hearing in the market today. Some systems are reporting a return of nearly 90% of their patient volumes from the onset of the beginning of the pandemic. Others are still struggling to try to get that to level out. However, as we think about what the future holds, there's a couple of things that we can start talking through, right? Planning for the additions to the procedures once patients return is necessary. I know we're thinking about that. I know we've got a lot of fires to put out. That is certainly a priority that we can continue to talk about. Managing processes with a reduced workforce will require us to do more with less. That is likely going to be all about finding areas of efficiency. How to remove the manual and kind of unnecessary work that your teams may be doing today that they may have been able to do in times prior. But today, given maybe a reduced workforce or different responsibilities, need to kind of shift priority so they can focus on the mission critical functions and essentially help us be stronger as we struggle through this and come out ahead. So the next topic that we'll talk about are some general conversations about operations and constraints. We've already established that there's quite a bit of financial uncertainty. This is a great quote from Jerry Pincer, the CEO of the American Medical Group Association, and also a quick snapshot and a chance to view the letter that was written to Congress. It's a call to action and an acceptance of support from Congress to provide some additional funding to help stabilize the front lines of the COVID-19 crisis. As of this morning, there have been 42 hospitals that have closed or that have filed bankruptcy, and that number is rising each and every day. So there is a cloud of financial uncertainty that threatens the ability for these systems, many are small and rural, to continue to deliver care to the best of their ability and to the communities that rely on it. So when we think about, well, what is driving some of these costs and how do we manage them? We've really bucketed a number of costs. This isn't an exhaustive list, but it's a great start into patient care and delivery and the administrative and the technical accountabilities and responsibilities that y'all might start seeing as you're navigating the pandemic and your response to the pandemic. Patient care and delivery, there are a number of increased costs around procurement of the PPE. Obviously, when this began, there was a level of scarcity with PPE that was very startling. And luckily enough, from what we've gathered so far from our clients and those that we speak with, that is leveling off, and that many suppliers have started to kind of transition some of their normal business into helping support and build and grow the ability and the variance of PPE that was available and that is going to continue to be available. But there's a cost for those to procure them and get them and bring them in so that you're prepared. There's also a level of expense for expanding telehealth services, things like required infrastructure to help support the flow of patients that might be very, very distributed across the country. And then there's a number of administrative and technical costs that kind of play into this, right? So the work from home kind of remote work environment that many of us are dealing with comes at a cost. Maybe that might not be a cost for the technology, but it might be a cost of engagement, right? An engaged workforce is a very productive workforce, which is time and money, right? And so a lot of conversation has been around how to keep people engaged. There are some new software and new applications that are being leveraged to help protect data as we think about going remote. That just creates a different level of dynamic qualities around how we communicate, and just general change management, right, around this new normal that we're living inside of. And we are somewhere in between the first wave and some may say somewhere in between the beginning of the second wave. So obviously it's really hard to describe and put your finger on exactly where we're at. But the reality is that there's no playbook. We haven't been through this before. At least many of us haven't. And we've seen that the entire health system came to an abrupt halt when the pandemic hit. However, and fortunately, will slowly begin to unwind as more care services are allowed to operate once again. There will be some frustration inside of that. There will be a level of complication, some problem solving to adjust to this new normal. And here are some great questions that we can ask of ourselves and discuss with our leadership team to help support this transition. So are you navigating burnout, stress, physical strain? Are you checking in frequently with your employee population to ensure that these things are discussed and that there's healthy conflict around this discussion so that you have a good finger on the pulse of it and you know how to react to it? Do you have a coordinated plan for more elective services and the return of more normalized operations? Again, a lot of it's like a puzzle. When the puzzle was initially put together and then it was taken apart, it needs to be put back together again. And there's a lot of pain and a lot of effort that goes into doing that. Which leads into the next question: that is your team empowered with the tools and the partnerships to help manage each phase and help support a steady transition? Are you communicating? And is the communication working? Does your staff, do your employees, do your patients know what's happening? Do they know what's happening right now? And do they know what to expect going forward? And what we emphatically know is that when we experience a situation like we're in today, the opportunity for fraud, waste, and abuse, unfortunately, increases significantly. And so managing ongoing compliance and having a strong and rich strategy to continue to do that and to do it in ways that you have maybe not considered before is certainly a question that needs to be asked of the group. So Matt, I think we've got another polling question here.
Yeah, this is our second polling question, and we'll launch this and interested in what you guys think. So what are your biggest concerns right now with operational constraints? Is that budget cuts? Is it administrative cost? Is it working remotely and dealing with all the nuances of that? Is it your limited workforce, or is it something else? And again, with the other option, if you feel like sharing, we would love to hear what that concern could be. And just going forward, we're interested in what you guys think. So appreciate your participation in the poll, and we've got one more after this. So we'll leave this open for just a few more seconds, and then we'll share those results. So the majority are budget cuts. That's not surprising. We know that's a struggle felt across the industry, and it's not surprising to see there that 39% of you guys are struggling with that. And yeah, we just appreciate your input, and yeah, thank you.
All right, thanks, Matt. And thanks, everyone. This is Donna. Welcome to the webinar again. Appreciate having all of you. Matt, if you want to go ahead and go to the next slide, we're going to talk a little bit about some of the knowledge gaps that are happening right now. So we just got done, Tim did a great job kind of setting the stage for significant changes that we've all been feeling relative to workforce reductions. Now, one thing that we want to point out too is that we're focusing on today really on workforce reduction, but we know that every health system, every healthcare provider is unique and different. So whether you've had a workforce reduction or you've had increased workforce, there's a lot of things that are changing relative to the people that are caring for your patients. So we just want to talk a little bit about the impacts of those. So when we think about that, we look at team members taking on new responsibilities. So when you either have either a reduction in workforce or a limited workforce, in that last poll, 26% of our participants indicated that they were worried or concerned about limited workforce. One of the participants in the previous poll indicated, that they had some fears around or concerns around staff calling in and not wanting to work, and also challenges because of the high unemployment payouts that people are getting. People are choosing perhaps to not wish to come to work and to just take those other benefits. So you have all sorts of new people likely in your organization, and those that are having to wear more hats. So trying to think through what are those new responsibilities, and where do we need to step up and help those folks. Are we able to cover each of the workflows, right? Are we really making sure that our compliance standards are met? You likely have significant numbers of policies and procedures and workflows in your organization, and with either people taking on new hats or more people coming into the organization, have you had the time to train them, and are you really sure that you're meeting those standards? Same with the next bullet, right? Do we have time to train or retrain our folks on those new responsibilities? Maybe in the past, you had a 2 or 3 day orientation process for your licensed professionals, maybe even more than that. In this real world that we're dealing with, the likeliness is you don't have that luxury. So you may be bringing on people with an orientation that may be online, and they don't have any face-to-face contact, or they're doing orientation on the fly in a stand-up at the nurse's station before they start taking care of their patients. So really thinking about how are we taking the opportunity to train or retrain folks that are in new roles. Are we sharing resources, and how are we optimizing these workflows, and what are we looking at? So it would be so interesting if this was a webinar where we could pull all of you and have you share how you've been able to optimize those workflows. But each of us has to look at the most efficient way to get folks trained and up to speed on their new responsibilities. So I think those are really important areas for us to consider as we're making sure that our patients are still receiving the quality of care that they need, and that from a compliance perspective, that we're able to feel confident that all of the controls that we had in place in the past are appropriately being managed and monitored today. So let's move on and talk a little bit about collaboration in our workforce. Oftentimes when we do our webinars, we do a poll at the very beginning, and we try to get a sense of who's on the call today, whether they're compliance professionals, HR professionals, ops people, clinical folks, legal. We didn't do that today, but I, as most of you know, or those of you who have been on our webinars in the past, I come from the compliance space, so my brain usually kind of tends to think that way. So we'll talk about the workforce collaboration perhaps from a compliance perspective. So this particular slide speaks to high volume health systems. That might be the health systems where either they've had high volumes of COVID patients, or they've been able to continue to provide care, and there's just a consistent flow of patients in their organization. You might also look at this as an organization that may have had high turnover in the past, as opposed to maybe high volumes of patients. So if you think about that from an HR perspective, what does that mean? Well, it means that they're asking for all sorts of help relative to recruitment and coordination, looking at credentials. How are they trying to stay on top of licenses and exclusions? How are they going to get these folks onboarded and screened appropriately? The clinical staff, the folks that are really trying to take care of our patients, are saying, help me, right? We need staff, we need PPEs, we need all that training that we talked about. And compliance on the other side is saying, hey, here's all these regulatory changes during the emergency declaration. What are we doing relative to policy updates? Am I getting more hotline calls? Do I understand whatever federal or state reporting requirements have changed? Am I sharing that information throughout the organization? Am I able to stay on top of it? And then what sort of ethical decision support do we need to provide? So I think it's really important. I'm sure that all of you have felt this in the last few months, that collaboration between all of these entities and all of these departments is really the best way for us to be successful. Let's look at that same collaboration, but perhaps in a low impact facility. Matt, if you want to switch to the next slide. So in this situation, our HR folks may be having employment decisions, right? who are we going to furlough, or do we have to cut staff? How are we making those decisions? Maybe our employees are filing more grievances or complaints based on those decisions. Are we making sure that we're meeting state minimums or staffing minimums as we're looking at the impact of a reduced workforce or a reduction in patients? Clinical is in that middle part, right? Trying to figure out, how do I modify my schedules? Am I making the decisions as to which folks can stay or which ones are going to be furloughed? Can my staff help other providers? Maybe I'm in a health network and there's 4 or 5 hospitals, or in my previous experience, we had nursing facilities, and are there other facilities where my staff can transfer and support? But we know in the COVID world, there was a lot of challenges with letting folks work in more than one location. And again, compliance is sitting on the other side, really trying to share and communicate and make sure that we're still following the rules. Matt, let's go ahead and move on to your next poll.
This is the final poll question. We know a lot of you have new responsibilities, and a lot of those processes that you have had in the past have been changing. So this is actually, you can select more than one option here, but what processes are being reevaluated currently to increase efficiency at your organization? Is that employee compliance monitoring? Is that third-party risk mitigation? Is it onboarding for new employees? Is it recruitment, or is it telehealth delivery? And we know that there are unique struggles with all of these processes, and we're interested in your all's feedback. So we'll leave that open for about 10 seconds and then share the results. Okay, thanks again for participating, guys. We really appreciate it. So telehealth delivery is the most popular option here. We struggle with that as well. Just the remote side of things, I know, is weird. We miss hanging out with each other at the office, and I know you guys have a lot of the same feelings. So thanks again for filling out our polls here, and we will wrap up here in just a second.
Thanks, Matt. And as we close out this session, there's just one more section. So process control and risk management, and some things to think about. So let's go to the next slide. So as we think about planning for this continuous change, or the new normal, I think that title is really important. I think the new normal is going to be continuous change. In healthcare, we always feel like things are changing, but I think right now, we're not going to be going back to whatever we thought normal looked like and felt like. And it's important for us to start thinking about how we're going to behave or react in an ever-changing environment. So one of the things from a compliance perspective that we always talk about is documentation, and the importance of documentation. Certainly HR and clinical, we would all say the same thing. But as we look forward to future audits and monitoring, it's going to be so important that we've documented the processes that have happened in the last 3 months, right? What things did we change? Why did we change it? What's the decision support behind that? Do we even know what's really changing? So being an agent of change and making sure that we're communicating and gathering all that information is super important. Identify which of these new processes will never return to whatever was normal, or the way they were in the past, right? So you're identifying the things that you've changed, and now you have to update your policies to match the new normal or the current state. How are you going to change your educational materials, right? We know that we can't just have written policies. We have to make sure that all of our team members understand what these policies are, and that we're sharing and educating those. So if we're in an ever-changing environment where staff are wearing multiple hats and more hats, and we have more people coming into our organization, the education component is really, really important. And prepare for the next set of change. I think we all continue to hear that there will be a second wave. Is that in the fall? Is that next winter? I don't think any of us really knows what that looks like, but we're going to continue through this process. So what did we learn in the last 3 or 4 months that we can replicate and do better during whatever the second wave looks and feels like? How can we, maybe it's just gathering or continuing to inventory PPE. Is it a change in our recruitment process in our benefits? Is it more part-time people, less full-time people? I don't know any of those answers, but just really making sure that we're looking back and learning from what we've just experienced, and trying to prepare differently for the coming months. And again, collaboration and communication, in my humble opinion, are absolutely the most important. Making sure that you're collaborating as a leadership team, but you're really collaborating and listening to all lines of business, all departments, all folks within the organization, and making sure that we're sharing and we're extremely transparent so that we are properly meeting our team members' needs and, of course, all of our patients. So certainly collaboration is so important. So I'm going to turn it over to Tim to wrap us up with the last slide or two. And again, thank each and every one of you for the hard work that you're doing every day and for joining us at Provider Trust.
Thank you, Donna. And really the last slide here is all about what questions should we be asking to find the efficiencies and to help us be optimizing our time and giving us the capacity to actually do more with less. So likely some questions around what has been done manually or what is being done in-house today that isn't a mission critical function, and how can that be revisited to find efficiencies. So do you empower your teams with the tools to help collaborate, to help communicate in the remote settings that you're in? Are there gaps in your communication or in your security processes? Or are your employee expectations for staying compliant being covered appropriately as you think about the changing dynamic of the way that we're working? And lastly, identifying again the opportunities that exist for automation and removing some of the manual work that has fallen on your plate over the years that just might not make sense to continue to support and perform. So Matt, if you want to move to the last slide, in the event that you are looking for easy wins to begin finding efficiencies and automating some tasks, Provider Trust can certainly help. For many of you that have been part of our webinar series, you know that we do offer a set of solutions that help ensure risk is being mitigated, employees are able to work, and that your organization is compliant in an ever-changing regulatory environment. And so I will leave you with the request that in the event that there is an opportunity to have a discussion around efficiencies in monitoring your populations of employees, providers, networks, and vendors on the licensing and the exclusion results of those folks, we would love to explore a conversation about how we can help do that. So with that being said, Matt, I'll turn it back over to you to wrap us up. Thank you all very much. We appreciated the time, and hopefully you found some good pieces of information inside of this.
Yep, thank you, Tim, and thanks, Donna, for being with us today. We so appreciate everyone being on the call, choosing to spend your time with us. We want to continue to be a valuable resource for you all. If there's anything at all that you think that we could help you with, we would love to talk. And we have over 300 resources for you guys on our website that cover all sorts of topics. So don't forget to scroll through there, and we have everything is easily filterable for whatever might be best for you right now. And with that, I just want to say, please fill out the survey after the webinar. It helps us get better, and be on the lookout for those follow-up materials this afternoon. Thanks so much again, everybody, and we hope you have a great rest of the week.